Hello and welcome. I'm Jo Thomas and I'm going to take you through a short video to inform you about a new clinical student deed poll. This is a compulsory document which comes into effect on the 30th of November and is a requirement for all students entering the SA Health environment. Consequently, you'll need to have this document signed and uploaded on your Ready for Practice site so that you can attend your next clinical placements next year. So here's what the deed poll looks like. It's 4 pages long and there's quite a lot of detail, but the emphasis is really around protecting patient confidentiality and privacy. These concepts are not unfamiliar to you, but you need to be aware of exactly what SA Health is asking for and requires of you. In addition, they mention that they will collect data on your personal information, but this will also be treated with the highest regard, just as patient privacy is respected. There's no option not to sign the deed poll because it's a requirement of attending placement. However, you should be aware of the contents. The first thing to note is that de-identification of any material that you're working on related to patients is really important. It's also good practice to ask patients for their consent if you're using their case for your work, such as in a case write-up. You might explain that this is part of a learning opportunity. In most attachments, you'll be given clear instruction about how to de-identify your cases. You will be familiar already with the policies around immunisation and occupational health and safety. This document re-emphasises your obligation to comply with those. You must ensure that your Ready for Practice page on Mahara has all these necessary documentation and is up to date at all times. This is your responsibility. As you can see from number 10, the emphasis really is on you to treat information appropriately and not disclose it to anyone unless authorised or it's appropriate to do so. The deed must be signed by yourself in the presence of a witness, then scanned and uploaded into Mahara on your Ready for Practice page. Keep a copy. If at any time you're unclear about your responsibilities or the correct course of action, or whether there might be a breach, speak with your clinical supervisor. Another option is to contact university academic staff who oversee your placement. If you're unclear or uncomfortable, it's really important to check. Thanks for listening. I hope it's all clear.